very warm welcome to the Values Workshop podcast. I have the privilege of having with me Dr. Rajesh Shah, who is a consulting homeopath, and I've been his patient for many years. Uh, One of the interesting things that I find about him is his ability to understand in depth a lot of things that we speak of on and off. Uh, Taking his patient's time, and sometimes um, I tend to talk about various subjects with him. So thank you, sir, for giving your time.
Thank you. Thank you so much for inviting me to your forum and podcast.
Thank you. So I will, without much preamble into other things, I am going to have this as a holistic chat on healing. And I was wondering what is the question that would be a good icebreaker kind of thing. So it's a very simple question. With so many patients that I've seen over the years in your clinic, and over the years, my whole family has become your patient more or less. Starting with my kid, and then we grew into one by one. All of us came to you, consulting you. One of the things that I find very peculiar is that as a patient, uh, most of us are not got good followers of advice from the doctor. Besides good followers of advice,
Okay.
so we will either mess up on the allied things that you say, don't do this, or else we will end up not taking our drugs on time, or we take it as per our moods and stuff. As a person who's into doing this thing for many years now, how do you view an ideal patient? What are your requirements from people who can help themselves become better patients? How do you see that?
Yeah. I suppose what you said is to an extent right. But over the years, I think I'm not too disappointed with patients now because I have also grown. I mean, my patience has definitely grown up. So primarily, you said that how the patient uh, can be helped by myself with their help,
Yeah,
right? So when we take up a case, uh, our primary aim is to make the patient aware of about himself or herself. That many a times helps to a great extent in relieving the ailments or the illness. Awareness creates a lot of difference in the system itself. So the first consultation that we do is very elaborate, and that envisages almost everything right from the inception, that is birth, to the day the patient lands up with me. And once the patients understand about themselves, the process becomes easier. Uh, you cannot know any phenomena entirely. So there is a kind of essential or practical totality, workable kind of a thing, so that otherwise I can go on taking patient's history for hours, which is
okay,
not really practical.
okay,
So when we take the first interview of the patient, it's almost like right from the inception till present day, whatever has occurred in his lifespan. I mean, right from genetic predisposition to the environment in which he has grown up, various modalities that he's been able to make out about himself, what affects him, uh, right from, physical factors to maybe metaphysical factors like thoughts, emotions, everything. So, uh, patient many times has never reflected upon themselves so much uh, that when we start questioning them, there are small peculiarities to a major phenomena like emotional shock or all these things in what way affects him is going to be very important. So that is how we make the patient aware about himself. And once the patient is in that mind state, then we can definitely suggest something. Many times the patient himself also starts following his own instincts better. So making aware, and if the patient is, I think, has that ability, uh, that becomes the main uh, uh, idea of uh, helping him out.
Okay.
So that is the process which we start with, and of course, later on, uh, medicine medicine system that we follow uh, has its role to improve. Along with that, the day-to-day, suggestion in day-to-day life activities and in what way to follow such things that we obviously give them, and that helps to an extent. Yes, right
Okay.
from the diet or mode of thinking, then physical activities, sunlight, the nature. The bounty of nature, how to make use of it, and how to follow nature and its mechanisms. That would be more in harmony with the system itself.
Okay. Uh,
So
yeah.
yeah, that's what we do. Make uh, patient help us.
Okay. Um, how much of a role does our mind play in our healing? So if
How
I
much of a role?
does our mind play in our healing? So if I come to you for say a stomach ache or a headache or whatever, and you are
Mm.
treating me, what is it that you look for in terms of uh, peculiarities about my ailment vis-a-vis some other patient who comes with the same complaint? What are the possible differences that you are looking for? Whatever is not a secret, please feel free to share.
Yeah, nothing is secret in this. I think I can share whatever I have, whatever I have any, if any, knowledge about this.
Mm.
See, every case, whether the main complaint or the ailment is the same or different, the entire scenario is different.
Okay.
Uh, Supposing if five patients have hypothyroidism, our system, that is, I practice homeopathy, so our system is very much individualized, and it is likely that all of them will have to be given different medicines because the entirety or the totality is different. So
Okay.
it's not just the thyroid, it's the person that we are treating. And all five patients are individual, very different. So it's little difficult for us to choose unless we know the thing in relative entirety. It's not just it's hypothyroidism, so there is a fixed medicine as in maybe conventional medicine. So it is very much individualized in homeopathy. We take into consideration everything, whatever is possible, before prescribing. I suppose you understand right from, as I said, genetic predisposition to everything else that uh, till date has occurred to that patient.
Okay.
Is
What about the immediate mind state?
Our mind is a very important factor in the sense while we consider totality or the holistic point of view uh, of any phenomenon, uh, mind and body both have, if not equal, if not more, at least equal importance. And we, as a homeopath, every time inquire about the mental state. So that makes a lot of difference in the totality or the view or the perception of that patient.
Mm, what happens? Suppose I'm very incommunicative in terms of why things are happening to me, or I'm withholding something, or I am being secretive about it for some agenda of mine, or whatever. I just want medicine. And typically, in today's world, we see you as a provider of a certain service that I'm only concerned on the superficial part of it. So I'll just come, I'll say I'm paying you, you give me my medicine, and that's about it. I may not reveal things. I'm sure things like those might be happening. How does it work in that case where you are unable to get into the genuine understanding of the mind state that the person is coming from?
Yes, that happens many times. Uh, but that itself becomes a kind of characteristic about that person.
Okay.
If the person is not very open, uh, as I said, we depend on a lot of things. So right from physicals, all the modalities we consider, and the mind, if is whatever to whatever extent is communicative, from that whatever we can derive, we come to a conclusion. That's a practical totality. That's what I say. We have to do some guesses at times. Uh, Again, we have to consider ourselves before we guess. Or even if a patient is very communicative, we have to find whether whatever he says, to what extent is a reality.
Okay.
Patient can always modify their statements, or he may himself may not be aware about himself. He can tell anything. We have to
Hmm.
take it into consideration all other things, whatever his actions are there in his life, that would also speak for him. Those who are not, absolutely uncommunicative, we we do give medicines, and then slowly they open up most
Okay.
of the time.
Okay. So instead of a lie detector test, we can have a homeopath test, is it? Um,
Lie detector is very crude method, I suppose. Ours is a very kind of a fine thing in the sense.
okay.
Anyways,
Um, so another question regarding the mind bit only. So as a human being who goes through certain experiences, you have a family, uh, you travel from one place to another to reach your clinic. There are other things in your life that may be happening besides your profession. What happens when you yourself are uh, not at your optimum best in terms of things that are happening to you, are upsetting you, or are too strong for you to avoid during that time? How do you handle yourself as well as your profession at that point of time?
yeah. Uh, I think this should be asked to my better half, but it's fine. We tried obviously to maintain our balance, what we call homeostasis. That is a little jargonistic, perhaps. A physiology is something which, I mean, physiology is normal functioning. Pathology is malfunction. So any phenomenon is when disturbed. The physiology enters into pathology. And as I said, when you as we try to make patients making aware of themselves, we obviously undergo the same thing when something goes wrong with us. Um, so once you are aware, you take steps to, correct it in the sense. When you are maybe emotionally disturbed, obviously you have to see where the imbalance is getting created and try to stop it at that level. When my diet is the culprit, obviously I have to change my diet. So a bit of illness obviously creeps with everyone, and that many a times is beneficial. All the time, if you are healthy, many times something is going wrong inside. You're not aware.
Okay.
So, to boost your immunity, once in a while you must get fever, once in a while you must get disturbed. Uh, that will make your system stronger. That's what our philosophy says.
This is beautiful. You've actually. So, is this also true of life? Do you, as a person, not just as a professional, think that a bit of negative circumstances in life are actually helpful?
Yeah, yeah. Everything going goody goody is many times. It restricts your development, evolution or your evolving your personality may get stunted if everything is going good. Not always, but many times it may occur. You must have some challenges in your life to grow um, and evolve, I suppose.
It's an interesting perspective. Another thing that I have often thought about, um, in this race of time, that we need everything immediate, the Insta age, if I were to call it. So we come. I remember we had a conversation some time back, and I had something. I do not remember what that ailment was. And you said
Mhm.
not everything is going to get resolved in a day. So relax a bit. Sometimes it may take 5 days, a week, or 10 days. It's all
Yes.
right. Do you find that this puts a lot of pressure on you in terms of choosing medicine to help people heal faster, or do you how do you deal with this pressure, or is there any pressure at all?
There is at times some pressure, but over the years I've learned to handle it. Obviously, you have to make your patient understand that all illnesses are not of the same duration. It may be some hours to some years also. So it depends on the illness, what is wrong, and depends on the duration of the illness and how your body responds to the medicines. All these factors will count when the duration of illness is going to be the factor. Patients do ask us to make it fast. Strong medicine they do and all that kind of thing. But obviously, I have to keep my mind uh, in true, right sense, so that I don't do something unnecessary. Which would rather harm than help them. Help them heal faster.
Okay. So one of the other things that came to me while you were giving your answers is you've been often using the terms phenomena. So it reminds me of a time that I had some kind of infection in my lung, and the doctor, we were talking to him, and he said we would rather think of patients as diseased lungs or heart or stomach, because if we become emotionally involved with the patient, we tend to lose objectivity. Um, so, is this the reason that you're using the word phenomena, or it is just the awareness that no matter what happens, it's a natural phenomena? How do you see this?
See, the biological system itself is a very dynamic thing in the sense. Uh, And I mean, its interactions, in internal connections, as well as to the entire universe, has to be kind of studied. And when we say a particular organ, a particular even human being, it becomes a kind of unit, or you have a very limited perspective of that system. But in actuality, it is very dynamic. We cannot call it a system or a unit. It's connected with the entire universe. Besides the internal connections that we go through, I mean, your lungs, heart, and all, they are all interconnected. That is internal dynamism. Our system, that is, I practice homeopathy. That in our philosophy, we have books on homeopathic philosophy,
Okay.
which states that all these phenomena, right from birth, death, disease, the process of cure, all such phenomena are very dynamic. I mean, it's not something linear, that this is the cause and this is the effect. Innumerable number, n number, many times we don't know what factors are affecting all these processes. So the whole kind of universe conspires for something to occur. So it's
Okay.
that dynamic, and we cannot call it something cause and effect. It's a phenomenon which is affected by known and unknown factors. These are all the modalities. We can know only partially and act upon it with the essential totality.
Okay.
Suppose I'm not too obtrusive.
No, you aren't. I was just amused by the thought that a patient might think, here is my doctor admitting that he doesn't know anything, and there are too many causes that he's not aware of. So besides the doctor, I need to go to an astrologer, perhaps.
I've not had much experience with astrology, but maybe stars and obviously sun and moon obviously affects our system, or I'm using the word system only. But
Hmm.
so they have that dynamic effects on uh, our system, and we have to take into consideration those also. I'm not, pro for anything like astrology, or I'm not against it, because I've not had any experience about it. But overall, as I said, whatever occurs is a kind of universal, has a universal cause. There may be local cause, there may be remote cause, and there may be obscure or uh, causes
Unknown.
which cannot be known.
Okay.
See,
But
sometimes philosophical, maybe uh, a conventional mind will not get into it when they come to us for specific treatment. They just say that this is it, and I want to get it kind of cured. So slowly they understand the things. I'm not too pessimistic about people.
do you get intimidated by the by what you just said, in the sense of so many things out of control could go out of control, or they are affecting the treatment you are giving, ABC? Uh, don't you do you feel intimidated? Do you feel participative? Do you feel uh, I don't know, what is your mind state about? So, for example, if I have come to you for again stomachache or XYZ, and I am talking about it, you are saying there could be local causes, there could be universal causes, there are genetic causes, there is my particular predisposition or disposition on that day. I have got
Yes.
stressed up about something. Uh, Besides which, there are things I may reveal, I may not reveal, I may be aware or not aware. So there are n number of things that are affecting my physical condition. Physical, I just bring it because that's the manifestation that we are looking at. So if I'm sitting
Mm.
with you, I'm just talking about one particular aspect. I may not be aware that my uh, other stresses are working inside. Perhaps I am unaware of that. So
Yeah,
as a person who knows all of this, are you intimidated or are you, how do you look at it?
I mean, I didn't exactly get you. I am intimidated. That is what you said.
Yeah, intimidated by the, so because there is a such a huge wealth of information on the subject
Okay.
that you can never have enough of.
Yeah,
Uh,
that's true. But as I said, cannot entirely know the thing. It's only partial. But our partial is really much bigger than ordinarily what people ask. So, uh, most of the time over the years, the patients learn from us. I mean, initially, obviously, you have to probe more, but then later on, they are quite cooperative and they know the importance of finer kind of inquiry. Um, I mean, we also evolve during this entire process as a doctor, and we know better and better how to go about it.
okay,
So there's no question of getting intimidated, but at times we are short of uh, essential totality, and we have to kind of guess. We have to do some guesswork and start with some trial and error kind of.
okay. Are you patient with yourself in terms of when suppose you're trying something and it is not working in some case and once or twice or thrice, are you do you give yourself space for that exploratory nature, especially because you're dealing with mainly physical health most of the time? So if the patient is in pain and obviously you've been trying to help reduce the impact or heal them, so how do you look at your own inability in the immediate moment?
I mean, I didn't get the question exactly. Uh, when I have something, are you talking
No,
about?
no. If I have something, I have come to you. You're trying to resolve it. So
Yes,
one day passes, 1 week passes, 2 week passes, and time passes, and you've been trying certain things and they are not falling in place.
yeah,
So
yeah.
how do you reconcile with that uh, disappointment of attempts and trials and errors? Is there a methodology? Is there something you're taught in your while you're becoming a
So
doctor?
there is one good quote about doctors.
Hmm.
I mean, a successful doctor is not the one who uh, is, I mean, who treats and the patient gets cured and then he comes back or he's fine. A successful doctor is one uh, who gets the patient continue coming in spite of being not able to help him.
Okay. So does this talk about charm?
That gives the time to the doctor. I mean, I cannot claim that you can cure everything and all, but at least it gives us the time for a better judgment and try harder for that patient.
Okay. So
So
it's a
with our,
combined
I mean,
effort.
counseling and kind of talk that we do with the patients, I mean, develop kind of patience
Okay.
and give us the space and time for better treatment.
Okay. Okay. Um, how uh, how difficult is it to be a doctor for you?
See, I entered the medical college
Hmm.
because I was curious about the biological system and human in particular.
Okay.
So it was kind of joyful for me to get the knowledge about myself, ourselves. I mean, of course, uh, The studies didn't go, very difficult, but developing a practice did take some time and effort. Otherwise, I think I'm kind of happy with my whatever little practice I've been able to develop.
Is there anything that you want to tell us about the effort it took or the problems you faced in setting up a practice? Was it something particular to you, or is it true of all doctors, more or less?
Yeah, I think every new doctor would be facing it unless he has an ancestral practice.
Okay.
I think there is a dilemma many times what to practice, whether to practice homeopathy. Even the fellows who study homeopathy, Ayurvedic, many times they don't practice the same thing. They start doing general practice, that is conventional medical practice, uh, which in my case never happened because I was firm about my belief. So I
Okay.
never tried for that. I started with homeopathic practice itself. I never went to a kind of uh, hospital training or anything which would give allopathic medications, obviously.
So you
Mm.
haven't been corrupted. So
Corruption, as
I
far
will,
as I
sorry.
mean, from the medical practice point of view, I've stuck to whatever I've learned and whatever I believe.
Yeah. Um, I am revisiting this question, but from a different perspective. Uh, that in today's day and age, one hears a lot about uh, certain conventional medicine helping heal faster vis-a-vis homeopathy, which is seen as slow, or there are other myths surrounding it. Uh, would you like to throw some light on what are the things that you face in terms of challenges because of this insistence on कल सुबह तक ठीक होना चाहिए मेरा बिजनेस मीटिंग है and ये होना चाहिए वो होना चाहिए and stuff like that. How do you deal with that? So it's the same question, but from a point of view of where we are so used to the pace of things that we think that even a ailment is an obstacle in my worldview. I need to be rushing all the time.
Mm. See, it's a myth. I would say that homeopathy works slowly.
Okay.
Acute illness, when you talk about, uh, it is definitely faster than the allopathic medications. Uh, the illness which has years duration, where many a times many suppressive medications which have been taken by the patients, and he never got cured with those tablets. They don't have anything to complain about if we take time, I suppose. They have not been able to cure it. When the then only the patients, most of the time it's so. They've tried allopathic, then certain other things, and then most of the time homeopathy is the last. Over the years, last option. I mean, over the years, the things have changed, and when you are in practice for years, you have a lot of patients who have experienced this, and they come to us only, even with high fever, gastroenteritis, ailments like pneumonia, typhoid. These are many of the times uh, supposedly serious ailments. But I have seen in my practice, I've been able to handle these ailments, and it is definitely not taking longer time. See, when there is no cure in conventional medicine, the disease becomes rather chronic and recurrent in their practice, and if that patient comes to us, is going to take time. I mean, many of the patients are like, drug dependent. To withdraw those drugs take many times some time. So it takes a little longer when the patient has had some medications or has had illness for months or years, and then you don't expect that it will heal in a day, two, or some weeks also. It may take months or years also. Depends on the illness, how advanced it has been, how the body has been tackled so far. All these factors are going to be affecting your speed of recovery.
Okay. Uh, one of the allied questions to an answer you gave some time back. Uh, do you believe in God and destiny and things like that? I'm asking this question both from the answer you gave that there are other things that affect us. How do you look at uh, quote unquote these unscientific ways of looking at things, or what's your particular belief about these things, and how does it impact your work for you?
I think many times the terminology that people use have different connotations with individuals. What you consider God, maybe it's not the same thing with the other individual. I have not found a very specific definition of a God. They say something like it's a power, or people may have some different
Interpretations.
acceptance. So it's going to be difficult for me to perhaps uh, give an opinion about it.
No, my question is particularly about what do you think, not an opinion on what others think. It is because it changes from people to people. Whoever you're talking to might have a different opinion, but because you said there are various aspects that affect healing, how do you look at these
Yeah,
aspects
yeah.
from your point of view?
But then these two are, I suppose, different questions. There are various factors which are known and unknown. That's what I
Okay.
must have said in my
Yeah,
earlier
yeah.
conversation. But when you say a term like God or destiny, what your understanding is will affect my answer.
Okay, my question is that these are so there is fate. Destiny means something is already pre-written. So if I'm supposed to get cured, I'll get cured. If that is a point of view that somebody might have. Or God might be that if I were to go and confess my sins to a priest or go and do a certain kind of uh, puja or something, I might get relieved of something. So my attempts will include the doctor and a certain place of God, whether it's a gurdwara, temple, church, mosque, anything at all. So I might apply and involve other people who are non-medical professionals, perhaps,
Hmm.
and try and get a solution. So it might be an idea, or it might be people, it might be uh, practices which are non-medical. So I want to know how do you look at this uh, vis-a-vis your own particular outlook of healing?
I think the first thing that you said was a destiny, that it is all destined. If this is going to get cured, it will get cured, no matter what you do or you don't do.
Okay,
I think entirely I don't agree with it. Then we don't need any action to be taken anywhere, I suppose. We leave it to the nature. I mean, whatever is going to happen, is going to happen. Why break your head upon what is certain? I
true.
suppose there is a good amount of uncertainties involved in our life, and
Yeah,
you do take action. So that is,
yes,
I don't agree with that.
true.
Uh, but I have something to say here. If you follow nature's, uh, I mean, natural kind of
Law.
mechanism,
Okay.
uh, that would help you more rather than something really disruptive in nature. Some crude medications, if you say, that will harm you rather than help you. This forum, I suppose, I cannot be very elaborate with our homeopathic medications, how they are prepared or uh, how it is diluted, and there are a lot of modalities while preparing homeopathic medicines. Maybe that's very kind of ultra diluted in an exponential way. When we have one part of medicines with 99 part of solvent, uh, kind of inert solvent,
Okay.
that becomes our first potency of the power of the medicine. One.
Okay.
From that first potency, when we take one part of it and 99 part of again solvent, that becomes the second potency. I am not being too technical, I suppose. Like that, our I mean the potency reaches like 1,000, 10,000, 50,000.
Okay.
I so there is after certain dilution, we are not able to find a single molecule of the medicines in that solution with whatever detectable, I mean, the mechanism that we have scientific this thing.
Hmm.
Uh, we believe, I mean, it's not yet entirely known that something, uh, some information is being parted to that solvent material that kind of gives uh, signals to our bodily mechanism, and the body uh, takes the action. If you know, like cures, like or similia similibus, that is what the basic principle of homeopathy. Our medicines are very dynamic, and it's supposed to give a kind of mimic. I mean, it is supposed to mimic a disease picture, which the body will identify and then take action on it. We don't, deal with the disease directly. We improve our bodily system. That's how it is curative. For the it is better equipped when the next time the same disease occurs. We don't have ready-made solutions like when you have an infection, bacterial infection. We don't give antibiotics. We give medications which would enhance our immune system, and it will learn to fight out the infections.
Okay. So
Some
does the body become intelligent over a period of time?
our medicines, that is homeopathic medicines I'm talking about, uh, kind of creates signals or give the body exact uh, picture what is going wrong in the system, and in that manner taps the bodily resources. The biological system is, greatly resourced. Most of the illness, if not all, but many of the illnesses are self-limiting. The body, has a lot of auto repairs mechanisms, but at times, because of reasons known and not known, they don't work. Then only it requires little signaling. Then the body itself takes its own course of action and correct the whatever has gone wrong. So we do that thing, not provide ready-made solutions, because they are ready-made solutions are a very crude way of correcting. They look upon very specific part of the system, and not the way we look, the dynamic way the system has got disturbed. It's not just a part that has got disturbed because of itself. It's the entire thing which is responsible for
Okay.
that part to go wrong. And in that way, we dynamically make the body to respond to that illness, and in that process make it learn the way to keep it fine.
Okay. Does that
When it
knowledge
is better,
continue?
same thing occurs again.
Yeah. So
Yeah.
my question is, does that knowledge that my body gets from the medicine becomes a future resource for the body to know?
Yes, of course. It's a kind of learning process for the body. Our medicine is supposed to give some information which would make the body to tackle the disease, right from infections to, I mean, all kind of metabolic disorders and all kinds
Right.
of diseases. Your immune system should learn to tackle this. The emphasis is that. That would provide you a long term, if not permanent cure. Permanent cure to a particular illness may happen quite often, but otherwise, a relative cure is good enough to make the patient comfortable for a long period of time. If you don't get the same thing, it should be taken as a cure.
Okay. One last question. So of late, in the last couple of years, there has been a growth of Ayurvedic practitioners in the country, and obviously there is a wealth of information in Ayurveda as well about healing and holistic living, stuff like that. But having
Hmm.
said that, due diligence has not been given to all aspects of uh, the practice itself, because a lot of people have grown and come into the system without any checks and balances happening. Does this also happen to homeopathy per se? And how do you look at how is so how does one look for a good doctor is my question.
I think it's a universal thing. Anything you practice, if you, I mean, there will be, especially in medical system and uh, in particular in homeopathy, because the medicines are very much individualized. So it will depend a lot uh, who the doctor is and what medicine is going to select. Kind of, it's I mean, finding a needle from this thing.
Haystack.
Yeah. So it'll depend a lot on the doctor's experience and his own kind of understanding of the phenomena. I should not, I mean, comment upon maybe Ayurvedic or other,
No,
given
any
that
system.
some.
The question is
Uh,
generic.
as I said, in any system, if the doctor is more experienced, obviously it will make more sense. But in conventional medicines, there is no individualization. So it's not that difficult, perhaps. If you go to four doctors with same illness, you will get mostly the same medications. So there is not so much of kind of
Emphasis.
thinking involved in that.
Okay.
As against maybe Ayurvedic and homeopathic medications, there are plenty of medicines from which we have to select on an individualized basis, because all these alternate so-called alternate therapies are constitutional in type. I mean, they consider your entire constitution, as we started with holistic medicine, as against conventional medicine. So it's kind of आयुर्वेदिक में वो लोग जो दोष बोलते हैं
Hmm. Hmm.
kind of we have certain other terminology which I think it will be difficult for me to explain.
Hmm.
But constitutional प्रकृति दोष जो बोलते हैं ना, those need to be corrected to annihilate, to remove your tendencies towards illnesses. Your constitution, the entire constitution is responsible for chronic recurrent illnesses. That has become a kind of your tendency. Either it has become or it has been there genetically. So, all chronic and recurrent disease, what we treat is a person who has the tendency rather than the illness.
Sorry, I got one more question, although I called that one the last question. You use the word tendency, so that kind of gave me a wake up this to that the values workshop. I haven't asked you a question about ethics and values and morality. So what part of human nature do you think that if I am morally corruptible or ethically not up to it, I invite disease a lot more, or does anything like that happen? Or how do you view morality in terms of healing? Is there any point of view that you have on that?
See, the things are never absolute. Most of things are like relative. There is no entire truth, or perhaps anything you can say. Definitely, this is it. I mean, your viewing, your perception itself make the entire phenomena change.
Okay.
There is one scientific principle that is called Heisenberg's principle, which says you cannot locate a particular subatomic particle exactly, because the viewing itself
Changes it.
changes the exact location of that. This metaphorically applies to all other phenomena. So it's a relative thing. Many times, a few things which look very corrupt in certain situations may look okay. But I suppose the thinking pattern does have a definite effect on our bodily mechanisms, your metabolism, and all. So each individual patient has to find for themselves whether it's going good for him or bad. Obviously, all our Hindu philosophy of karma will say that when you do good, things will become good. I'm not too sure whether really it happens.
Okay.
And of course, you believe that the next birth or all that, I have not yet entered into so much. I think this perhaps transcends our
Topic itself.
the topic. I mean, the
Scope of.
basic thing that we started with. Yeah.
Yeah. Oh, thank you, Dr. Shah, for those lovely answers and very enlightening point of view about a lot of little things that I have also wondered about for a long time. I enjoyed this chat. I hope it was not too difficult for you as well.
As I said, this was perhaps the first time I'm on any such kind of a platform, and rather I should be thankful for you inviting me and giving the first chance, perhaps.
Thank you, sir.
Thank you. Thank you, sir.
I'll see you around. Yeah.
Yeah, sure. Okay. Thank you.
Yes, sir.